North Arkansas Partnership for Health Education is all about how two great organizations like North Arkansas College and the North Arkansas Regional Medical Center can work together to do more than either one of them could have done on its own. We started this partnership about 15 years ago, and really we had two goals in mind. We wanted to encourage area young people, area students to consider medical careers. And second, we wanted to provide continuing education for the people that were already in medical fields. And this benefited both the college and the hospital. The college has almost a third of its graduates going into allied health careers. And of course, our hospital has a need for all these professionals. So the obvious benefit was to encourage young people to go into these programs, to be nurses, to be CNAs, to be med lab techs and rad techs and surge techs and paramedics and the other majors that we offer. But also the benefit to having continuing education here at home for allied health professionals also was a great one for our college classes, because our students who were in these programs were exposed to all these experts that come in and present in their fields. So that's the way we got started, for those two reasons. But with the tobacco settlement money, we were able to expand the program. We were able to offer more initiatives. We were able to go into other areas. We started Arkansas's first hometown health improvement project. We've started support groups for chronic diseases. We've done so many other things that have all been entrepreneurial in nature. We have a community health resource center where if a patient goes to see his or her doctor and they're diagnosed with some kind of disease, they can go to our community health resource center and read about the disease and follow up on the doctor's advice. And the doctors have started referring these people to the center. We have a Susan Komen program where we fight breast cancer and encourage regular checkups, and we have all the pink out nights and the other things that are associated with that. We've got so many good programs, and we've taken this NAPHE partnership that started with really two people and expanded it into a staff of a couple of dozen. And we've really done it in an entrepreneurial type way. We haven't spent a lot of the college's money. We haven't spent a lot of the hospital's money. We've been able to get the grants and take advantage of the opportunities and grow the program. And really, one person deserves a lot of credit for that, and that's Dr. Rick Henneter. Rick was the first executive director of NAPHE. He had the vision for what it could become, and for years he did a wonderful job running the program. Now we have Sherry Hendricks, and Sherry has been able to take what Rick built and really expand on it, and I see a terrific future for the program. Sherry has the expertise that comes from running an AHEC in Missouri. She's run clinical sites for medical schools, and I can see us growing this program and developing it and making it into something even greater than it already is. But we're proud of it. We're proud of the entrepreneurial nature of it. We're proud of the way that we've been able to grow it. And I think it's an excellent example of the power of partnerships.
The partnership between the college and the hospital is a natural fit because we're both in service to the community. The relationship is based in both organizations' mission to provide healthcare services to the region. And I brought something to read I think will send a very clear picture of how this relationship works. And the mission of NAPHE is to provide quality, dependable, convenient, and affordable healthcare education services and programs to the healthcare providers, healthcare professionals, and citizens of the North Arkansas region. In that statement, and in similar statements that we have in our mission at the hospital, we are both in service to the citizens of the community. And as we fulfill this mission together, we reach out to the community to provide those individuals who are interested in healthcare education, interested in growing their careers and working in a hospital, and serving those citizens in the community in which they live. NAPHE reaches not only into education, but into services outside the educational realm to community, or the formal educational realm, to community education. And they reach into the schools. They do tobacco education, alcohol education. They reach into the education of teen mothers. There's a number of things that NAPHE does that serves as a great partnership with our hospital. The benefits of receiving well-trained healthcare providers from the hospital perspective allows us to fill those positions of great need in our community so that we are available to provide the services this community needs. Our hospital is about 75 miles from any tertiary care center. We need to provide services in this community. This community needs a hospital. This community needs an emergency room. This community needs some very high-level services to meet the needs of the citizens here. And the college, in partnership with the hospital, in doing these educational services and creating these young folks who are interested in providing that care is invaluable. And it cannot be replaced by any other means.
Hello, my name is Sherry Henricks and I'm the Executive Director for the North Arkansas Partnership for Health Education, what we call NAPHE. And what an exciting partnership it is. About 14 years ago, NAPHE had the opportunity to work with the Arkansas Department of Health to develop the very first ever Hometown Health Coalition in the state. The success of creating a healthy community depended on the commitment of those who live in the community. And that is what the NAPHE partnership is truly all about. Commitment, working together, getting things done for the good of everyone.
My name's George Holcomb. I work with City Housing at Harrison. This city has been trying for as long as there have been community development block grants to get some money from community development block grants to do community development, to do housing work, to do community upgrades, all sorts of things. Well, it's never been possible because we have a geographical anomaly. The way the census tracts are drawn, we've never been able to qualify. People at the state look at the census tract information and they say there's no place in your city where any poor people live. This is manifestly not true. But how to prove that? Well, there is a provision that allows you to do a survey, but you have to go knock on a lot of doors, like several hundred doors. And after several months of working on this, I had just about given up. I went to a meeting of the Hometown Health Organization, talked about this survey project, and admitted that though I thought we'd done our best, I didn't think we were going to make it. A VISTA volunteer who worked in the NAPHE office went back and talked with them about it. She got it. She knew what I was talking about. The next thing I knew, I got a call from Sherry Henricks at NAPHE, who said, "How many volunteers do you need? Let's put them on the street." And we did, and we made it. And we haven't gotten community development grant money yet, but we can play now. We have established that, in fact, there's a large contiguous area of the city where most of the people need some help, and the city needs some help to serve them. So thanks to NAPHE, thanks to VISTA, and thanks to people being willing to help one another out and act as partners, as honest, decent partners, we're getting something done.
The local residents from your standpoint?
The health of the local residents has been positively impacted by the program in many, many ways. I've spoken mostly about the allied health education, professional education programs, but NAPHE has evolved with time since its inception. And there are many programs that reach into the community, that reach into the schools, to create a healthier environment for our students, to deal with teenage mothers, to manage the health, or to assist in managing the health of those folks. NAPHE has evolved its mission to serve the community in many, many ways. Tobacco abuse education, alcohol abuse education, educating students on the recreational drugs that you see in the drugstores now that so they're doing their best to improve the health of not only the citizens of the community, but the students in the schools.
That's it for the questions. If there's anything else you could think of that you want to add, any points that maybe I didn't ask you, it's important to mention in the video.
The only one thing I want to mention that's extremely important is that there is a tremendous community spirit in this general geographic area. And that community spirit is demonstrated by the strength of the partnerships that we have with the folks in our community who are attempting to lead an effort to improve the overall quality of health. There are a number of efforts here, and at this point in time, we are, as we speak today, I have a number of people in our community coming to the hospital to provide us information as we are doing our own community needs assessment, and how the hospital can then have positive impact on the overall improvement of health in this community, to limit those folks in their needs for chronic health care treatment. So the partnership here is extremely important. Thank you.
No, there will. Okay. Well, we can put audio and slides in this, so we'll probably get, I might go get that.
There doesn't seem to be any need for folks here in this community to take credit for programs independently. They take credit for everything that is accomplished together, and that's what makes this program so highly successful.
NAPHE contributes to the success of our organization in many ways. We have partnerships in education in nursing, education in radiologic technology, education in laboratory, CNA education programs, and in really simple form, those folks who are native to this area, who love living here because of the natural resources here, and if they can learn a professional, in professional services to an organization, learn, I hate to say a trade, learn a professional educational background that they can then use to provide care in this area, live here, work here, and contribute to the overall economy. And both organizations contribute to the economy in this community. Our hospital is the number 2 employer in the market. And we contribute about $34 million in salaries to this area on an annual basis. And many of those salary dollars go to students who were trained by the college and were pulled into the college by NAPHE.
Would you recommend this type of educational corporate partnership to other communities across the nation?
I would recommend a partnership of this nature to any community who has a need for allied health or professional healthcare education. There were some very forward-thinking individuals in this community who got together to form this partnership. And I brought something else I thought was rather interesting, and I wanted to make sure that everyone knew. Excuse me. Let me start over again. What was the question again? Excuse me.
Would you recommend this type of partnership to other communities across the nation?
The partnership that we have with the college, I would recommend to any community who is in need of professional healthcare providers. In the current market, there really aren't any communities that are not in need of professional healthcare providers. I think that it's very important that we are clear about what this organization is, because there were some very forward-thinking individuals in the past who built this partnership to better the community. And there's a couple of statements in the bylaws of NAPHE that I think are important to understand. One of those statements is to promote existing allied health programs. That was designed to allow those students to do their internships in our organization, and so that we can have instructors in our organization partner with those allied health programs to grow them and make them more important for the community. To assist in providing area public school students with an awareness of an orientation to allied health careers. To reach into the educational system, which is a very strong educational system in our community, to spark that interest in folks who are interested in being in the healthcare profession. Next, to provide continuing education and training for healthcare occupations through a variety of methods, including new technologies. The college has invested in significant resources, both human and other, to train folks. There are some state-of-the-art healthcare education equipment, supplies, space that a lot of colleges would be jealous to have. Next, to establish a site or facility dedicated to healthcare-related learning. That's the college and the hospital, and that partnership is very strong, and we're working very, very hard to grow that partnership. Next, to improve the overall quality of healthcare by providing a more competent labor pool in healthcare occupations. Now, this is where the purposes of the organizations cross. Because as a not-for-profit community hospital, we are responsible for contributing to the improvement of the health of the people that we serve. And we're spending a lot of our efforts in trying to develop programs together that do just that. And finally, to identify and meet the need for new allied health degree programs available to the citizens of our area. The college has continued to grow their programs, to continue to provide level of education here that it contributes to the community in a very meaningful way. So the partnership is very, very important.
What was your personal impression when you moved into this area and heard about the accomplishments of NAPHE and this partnership?
When I came to Harrison, I've been in the community a little more than a year. When I came to Harrison, I was very fortunate to have met the new president of the college, Jackie Elliott. And we both agreed that the resources available to the community through the college, and in her experience and in mine, were very, very significant. There were things here that were not available in other colleges. The partnership between the hospital and the college was stronger than any I've ever seen. And to have a formal, essentially contractual relationship through which we share resources and work toward common goals is relatively unheard of. And it's an important relationship.
What do you see as the future of these type of partnerships? How do you think they will evolve and respond to the changing needs of the workforce in healthcare?
The changing needs of the workforce, the changing needs of healthcare, the changing needs of healthcare reimbursement are going to drive a need to provide many, many more healthcare professionals, from physicians to laboratory technicians to radiologic technologists, nursing staff, as many, many more people begin to access the healthcare system on a voluntary basis, as they are added to the roles of whatever insurance program is being developed. There aren't enough folks. And frankly, there aren't enough hard resources either. So we have to work very, very hard to try to meet that need. There's been projections of needs of professionals that all the colleges in the country can't meet. So we're working very, very hard to contribute the best we can.